Towards the end of 2002 was when Don Norton felt as his hip was getting worse day by day. He then spoke to his general practitioner and decided to get connected with an orthopedic surgeon about his options.
It wasn't just achy sore. I'd take maybe 10 steps and get a real sharp pain. And I thought, well, I just can't go on like this.
He thought the surgery would take place in 3 to 5 years, but to his surprise, they told him in about a year he would need the hip replacement procedure.
There is important prep before the surgery. You're given exercises to do. And if anybody out there is going to have a hip replaced, let me recommend doing the exercises.
The exercises are to strengthen the muscles that will be impacted both before and after the hip replacement. Not only are the exercises done prior to the surgery, but also after.
The exercises before the surgery and the physical therapy and exercises after the surgery are so important. It's what's going to help with a smooth recovery.
The day of the surgery, they have you walking up and down the hall after the procedure, but want patients to use a walker for stability about 10 days after. 7 to 8 weeks after his hip replacement, he felt comfortable doing just about anything like he did normally.
I think the doctor said to me on the follow-up checkup, it'll probably be a year before you forget that you had a hip replacement. And I'm not even sure it was that long.